بسم الله الرحمن الرحيم. محاضرتنا عنوانها arterial pulse. تحديدا we will focus on the radial pulse. My name is Tariq Kafafi, lecturer of cardiovascular medicine at Asyut University. First, what is the definition of the arterial pulse? Pulse is actually a Greek word meaning moving to and fro. Which means that it is a movement happening repeatedly from one place to another, from the heart to the peripheral circulation. Arterial pulse is actually a wave that is produced by cardiac contraction, cardiac systole, and it traverses from the ventricle to the aorta ومنها into the peripheral circulation and the arterial tree. This pulse wave travels at a fast speed. Actually, it is 10 times faster than the blood flow itself. بمعنى إنه the arterial pulse wave precedes the blood flow into the arterial tree. The speed of the pulse wave is 5 meters per second or 18 kilometers per hour, while the blood flow occurs at a slower pace at about 0.5 meters per second or 1.8 kilometers per hour. The ejection of blood from the left ventricle into the aorta and from the aorta to the systemic arterial circulation creates a pressure wave, and this is felt as pulse. And this is actually best felt in arteries that have two important characters. First, arteries that are superficial regarding their surface anatomy. And the second important specific character is that they pass over bone so that they can be easily compressed and felt. ومثال لذلك is the radial artery that we are going to study in our lecture. Noticeably, it can be possible to feel a pulse even if there is no flow of blood in the artery being palpated. وده دليل على إنه pulse wave is faster than the blood flow occurring in the artery being felt. Regarding the radial artery, which is the focus of our lecture, if we study the surface marking, the radial artery is felt in the wrist, lateral to the flexor carpi radialis tendon, as we can see over here. So it is felt lateral to this tendon, particularly at this spot. So now, how can we examine the radial pulse? There is a special examination sequence that we have to adopt when examining the radial pulse. The first is that we place the pads of our 3 middle fingers over the right radial artery as we are standing on the right side of the patient during examination. And while placing the pads of our 3 middle fingers over the radial artery, we assess 3 important things: the rate, the rhythm, and the volume of the arterial pulse. After that, we check if the patient has no shoulder or arm pain or any problems that would restrict the movement at the level of his shoulder. And then we raise the patient's arm vertically above the patient's head. We aim by this maneuver is to feel if there is any change occurring in the volume of the radial pulse while raising the patient's hand or arm above his head. This is what we call assessment of collapsing pulse or water hammer pulse, which has special clinical implications as we are going to see further in our study. After we assess for special character pulse, namely the collapsing pulse, we check for the equality of the radial pulse on both sides by palpating both radial pulses simultaneously. so that we assess if there is change or delay in timing of the radial pulse between both sides and any difference in the pulse volume. Similarly, we may also palpate the radial and femoral pulses simultaneously, again to assess if there is any timing or volume differences between the radial and femoral pulses. This shows how we examine the radial arterial pulse with the pads of the 3 middle fingers. We assess the rate, the rhythm, and the volume at this stage, and also by rolling our finger pads over the radial artery, we can assess the state of the arterial wall and whether there is stiffness of the arterial wall, which is encountered in case of severe arteriosclerosis. This is how we examine and assess for collapsing pulse. So after we instruct the patient that we are going to raise his arm to check if there's no problems in his shoulder joint that would cause him pain, we slowly raise the patient's arm vertically above his head, and with the base of our fingers, this time not the pads, but the base of our fingers, we assess whether there is any change in the volume of pulse, namely an increase in the volume with this maneuver, which in this case would be termed collapsing pulse. And one of the causes of it is aortic regurgitation. So when we assess the radial pulse, we would check the rate, the rhythm, the volume, the character, the state of the arterial wall, the condition of the wall, and we compare both radial arteries on both sides to check for any differences in time and in volume. So regarding the rate, the normal heart rate is 60 to 100 beats per minute. And if it is less than 60 beats per minute, we say that the patient has bradycardia, while if it is more than 100 beats per minute, patient is said to be having tachycardia. This diagram represents different ECG strips that represent different rhythms. So this is the normal sinus rhythm, while the middle panel shows occasional irregularity due to ventricular extrasystole, and this is chronic irregularity in case of common arrhythmia encountered named atrial fibrillation. So regarding the volume refers to the perceived degree of pulsation and reflects the pulse pressure, which is the difference between the systolic and the diastolic blood pressure. The systolic represents the stroke volume, and the diastolic blood pressure represents the arterial compliance. The pulse volume could be named normal, or low if it's below the normal, or high if it is above the normal. So as we can see here that the pulse volume is rather subjective and depends on the experience of the examiner. The ventricles fill actually during diastole, and they contract and eject their content of blood during systole. So the longer the diastole, the more time the ventricles have to fill with blood, and the greater would be the stroke volume. And this is reflected by an increase in pulse volume on examination. Lastly, we come to the character of the arterial pulse, which refers to the waveform or the shape of the arterial pulse. If we look to this diagram, we can see that the arterial pulse waveform has an upstroke to a peak, and then a downstroke. So it has two limbs, a rising limb and a falling limb. The rising limb is called the anacrotic limb, and the falling one is called the dicrotic limb. And this represents the different phases of the cardiac cycle. So the systole takes the whole anacrotic limb and part of the dicrotic limb, while the diastole takes the rest of the dicrotic limb. If we interpret this in terms of the pulse character. One of the famous pulse characters encountered is what we call the water hammer or the collapsing pulse. And we have previously shown how we examine it by raising the hand vertically above the patient's head and assessing for a change in pulse volume with the base of our fingers placed on the radial artery. So this is the normal arterial waveform, and this is the waveform of the collapsing or water hammer pulse. What we can see is that the collapsing or water hammer pulse is characterized by a rapid upstroke to a higher peak and a rapid downstroke compared to the normal pulse. So now we come to the end of our lecture. I hope it was of benefit for you. All the best. Thank you very much.